Hey Dad, what did getting the vaccine feel like?
It was amazing.
My name is Isabel DeRoy-Olson and I'm a citizen of the Trondequitchin First Nation. I currently live in North Vancouver on Tsleil-Waututh territory. A couple months back, my dad was able to get the COVID-19 vaccine. That's because the Government of Canada decided that people in Indigenous communities should be prioritized. That got me thinking, why were Indigenous communities prioritized? And how has the vaccine rollout been going?
Well, that's a really good question, Isabel, because I think a lot of people wonder why Indigenous people are being prioritized. But the reason is that when the National Advisory Council for Immunizations, which is the federal independent organization that determines who should be prioritized, they looked at Indigenous peoples across the country and recognized that they were more at risk for COVID-19.
The reasons why are going back to the days of the Spanish flu, which is some of the earliest pandemics we have information for. Indigenous peoples have always experienced unequal impacts. They've always had more infections and more severe outcomes from these respiratory illnesses, viral infections, than we would expect just based on population size. Those reasons aren't because of any genetic differences between Indigenous people and non-Indigenous people, but they have to do with the ongoing impacts of how this country was developed and the impacts of colonization that put Indigenous people in environments that make it more risky for respiratory viruses to spread. And this includes things like overcrowded, inadequate housing, income insecurity, and food insecurity.
I wanted to talk to someone from an Indigenous community who had already received their vaccine. Turns out I didn't have to look any further than my own house. My dad got his vaccination as a part of the prioritization of Indigenous communities. Hi Dad, can you introduce yourself to everyone watching this?
Yeah, hi, I'm Steve DeRoy. I'm Anishinaabe from the Ebb and Flow First Nation and Lake Manitoba First Nation.
So Dad, why were you able to get prioritization to get vaccinated?
Well, it's because I'm First Nation and I live on reserve, so I was able to participate in the Tsleil-Waututh First Nation community vaccination program.
Can you tell me a little bit about your experience?
My experience was excellent. The clinic was really well organized. It felt really safe. The nurses and the practitioners were all able to provide me the information I needed, and it was a really, really excellent experience.
Has the rollout to Indigenous communities been successful?
Yeah, I would say it has. And you know, the statistics bear that out. Right now, 99%, over 99% of First Nations communities actually have access to vaccine clinics. And the COVID cases since the vaccine rollout started have dropped 80%. I would say that there's traditionally hesitancy amongst Indigenous peoples towards the federal government, towards, there's been vaccine hesitancy for good reason because of colonization and systemic racism within healthcare. So there's been an extra steps that need to be taken to overcome that vaccine hesitancy. But overall, it's actually gone quite well.
Some Indigenous people use traditional medicine when they're sick. In your view, does the vaccine go against or with traditional medicine?
That is a great question. And you know, when I got my first dose of the vaccine, it was February 8th, and it was at the clinic that we had with traditional healers and knowledge keepers in Winnipeg. And so we had a bit of a ceremony there, including a pipe ceremony and some singing and some praying. And then these traditional healers and knowledge keepers, as well as myself and some other health professionals, all got vaccinated at the same time. And I think that's a really great example of how we can use all the tools that are available to us, Western medicine like vaccines and traditional healing and traditional medicines at the same time.
We reached out to the federal opposition to get their opinion on prioritization and rollout, but did not get a response. Indigenous peoples and communities are often lumped together as a single identity, when in reality they are full of diverse cultures, practices, and languages. Did the federal government's recommendation and the provincial government's rollouts adequately consider these differences in their approach?
The federal government did consider First Nations, Métis, and Inuit peoples. One of the things that I don't agree with is there is a heavy emphasis only on remote and northern communities, because what our data showed here in Manitoba was that off-reserve First Nations people, including in Winnipeg predominantly, had at least as high rates as First Nations people who live in reserves or in northern or remote areas. And so I think it's important that we realize that First Nations people in urban environments also at higher risk because of those previous things I talked about, like housing and income insecurity and food insecurity. So I would say there was not an even application across the board for First Nations based on where they lived, on or off reserve.
With more shipments of vaccines arriving in Canada, more and more Canadians can be vaccinated. According to Indigenous Services Canada, as of May 2021, over 50% of adults in Indigenous communities have received at least one dose of the COVID-19 vaccine. For CBC Kids News, I'm Isabel.